Recently, the Veterans Administration sent a questionnaire to more than 800,000 veterans as part of the Million Veteran Program to collect information about their experiences during the COVID-19 pandemic. VA researchers were interested in collecting and analyzing data that could help provide insights into the genetic makeup of the infection, factors that could help predict the severity of an infection, and learning how genetic traits respond to COVID-19 treatments. Now, joining us this morning to share with us more about this important study is Dr. Suma Muralidhar. Thank you so much, Doctor, for taking some time with us today.
Thank you for having me.
The first question, what can genomic research teach us about COVID-19?
Well, our health and our risk for disease is determined by a number of factors. First and foremost, our own DNA or our genes that we inherit. Second, our lifestyle, smoking, drinking, exercise, and the like. And third, what we're exposed to in the environment. And now, along with the answers we have from the questionnaires we've sent out, we have a data set that we can investigate and ask the questions. What role does our own DNA, our genes, play in the way we experience COVID-19, whether it's an asymptomatic infection, mild infection, or a more severe form? We can also ask the questions, do our genes determine how well we respond to COVID-19 treatments and vaccines?
Can you highlight a few studies the VA is doing in this space right now?
Sure. The Million Veteran Program is one of the world's largest database. We have more than 840,000 veterans enrolled. And so researchers are tapping into this data set to ask the question, what genes are associated with a higher risk for getting severe COVID or even resulting in death? We're also asking the question, are there genes that are protective? And what genes are causing complications of COVID? We know that COVID impacts a number of organs in the body. So we're looking at acute kidney disease, blood clot, and what genes may be associated with that. And lastly, we're using genetic information to ask the question, can we find new treatments for COVID-19?
And you may have answered this right there in that answer there, but how can these studies help us in this fight against COVID-19?
Sure. If you're able to identify genes and then understand how they work, how they're causing the effects that they are, then we will be able to design new treatments. We can also find new ways of preventing COVID-19. And because in MVP we have a very racially and ethnically diverse group of participants, we might be able to identify new genes that may be very important in these minority populations that we did not know about before.
Of all those studies you mentioned earlier, which one do you see as the most promising?
Well, I'm glad you asked that question. So recently we published a study in Nature Medicine, and this was taking the genetic information, genes that are involved in severe COVID, and screening them against a database of drugs that are already approved by FDA for other diseases to see if any of those can work against COVID-19. And the study found a drug that might be very helpful to treat early COVID. So our researchers are now designing a clinical trial to test if we give this drug as soon as a person tests positive, can we prevent progression to severe disease? Can we prevent hospitalization?
And where can veterans go to learn more about the Million Veteran Program?
Well, veterans can visit our website, mvp.va.gov. We have a women's campaign going on now, so I'd encourage women veterans in particular to visit the site. And veterans, spouses, and caregivers, if you have not got your COVID-19 vaccine, please do visit your local VA.
All right. Doctor, thank you so much for your time today.
Thank you for having me.
Absolutely. Folks, if you want more information about the Million Veteran Program, we got that information, how to sign up, right there on the screen.
The preceding portion of Daytime Tri-Cities was sponsored by